Emerick, we really appreciate you joining us this afternoon. Thank you for taking the time. I know you're really busy right now. We just thought this would be a great idea to have you do a little question answer with us. You're very respected in our community. We're going to listen to you, and we just appreciate you taking the time. Kristi Anderson, our safety director, is here with me this afternoon. And if you don't know, it's almost 7 o'clock. So Dr. Emerick's doing us a huge favor to talk about COVID and everything going on right now in our schools. So, Dr. Emerick, do you just want to give us kind of a brief overview of what you're seeing? And we have a couple of questions for you. Any advice you can give us to help us?
Absolutely. Obviously, COVID is everywhere right now. We have many counties in state of emergency because of the number of cases. We have a increased hospitalization mainly in the adult group. I'll say the middle-age group is significantly affected by this, mostly because that is the group that really wasn't hit hard the first time, as well as this particular strain has a higher transmissibility index. So whereas alpha COVID or the first COVID, each person spread it to 2 or 3 people, this particular variant, you're spreading it to 7 to 8 people. And so because of that, you're just seeing 7 to 8 becoming 64 very quickly, as opposed to becoming 9. And so just 2 episodes of transmission can multiply very quickly. More people have it, more people are going to get sick, and then you're seeing the cases. We are similar in phase to other countries that have had Delta variant before us. So we're kind of probably, depending on the county, in different, in relation to the peak, we're pretty close to peak in most places. I think Taylor County is a little behind for our clinics in Madison County and Alachua County. We've had this a little longer, so we are seeing it peak a little later in Perry. As far as our practices, we are seeing more sick kids, absolutely. We had started the day with 30 patients in Perry this morning on the schedule and had 111 patients in 45 minutes. So this is very reminiscent to me of when swine flu came. We have a high transmissibility virus that is making kids a little bit sick, I will say, flu-like symptoms. We're seeing fevers, things like that. But because of school protocols, because of not trying to spread it to everybody in the family unit or go out with it, everybody's wanting to know if they have regular crud or if we have corona. So the biggest issue for us has been separating out what's normal, because typically our second week after school starts is always busy. That is when busy season starts for us. So that's not abnormal when everybody's trading germs for us to see sicker kids. It's just unfortunate that this time it's corona. But it is here. Kids are getting sick, but not, we can address that farther, but they're getting sick, but not hospital sick. This is not something where we're seeing multiple kids be hospitalized for. So if that,
we want to try to help our parents feel a little more ease about school. I know the other day you spent probably 30 or 45 minutes with Anderson and I talking about things. The biggest thing we're getting as parents thinking, we need to shut the schools down, shut everything down. When I'm talking to the medical community, that's not what, is being the message we're getting. So can you just talk about the pros and cons and, your recommendation for us moving forward, please?
Sure. I think the pro to school closing would be that, yes, less kids might transmit to less kids. Although this is not a very kid-to-kid transmission virus, even in the Delta version, especially for the younger kids. It does transmit higher than Alpha did, but still not at significant rates. More kids get it from home than they get it from school. And so if you close school, the con would be that all these kids are now home. The parents still have to work, I would assume, or still are going to go out and do daily life activities. And so now you're just actually making the kids more likely to get it at home or have to go to a group setting somewhere else because the parents have to work. So either we're going to endanger grandparents or boys and girls clubs or whatever has to be made available because the school's not there, you're just shuffling the deck. You're not necessarily eliminating the risk. So if, yes, all kids could go home and be in a bubble, yes, we would slow down the spread in school, but realistically, that isn't going to happen. So I would think you would prefer them to be in a setting where they're low risk versus low risk versus low risk versus higher risk. So I think the big fear is that all these kids getting it out of school and bringing it home, it's home to school that's the problem, not school to home. So I think you're just delaying the inevitable and shuffling the deck if you don't have kids in school.
Dr. Emerick, what are some symptoms that a person, where should they get tested?
So the hard part about COVID, especially in kids, is that it looks like everything. So you could have anything from diarrhea and a sore throat to, flu-like fever, body aches, chills, the whole 9 yards. They're both COVID, which makes it very difficult because it looks like everything else we usually see this time of year. So if it looks like strep and it looks like flu and it looks like RSV and rhinovirus and all the other fun things, it's very difficult for us to differentiate. So the only test we have is either our PCR or antigen testing to actually determine whether or not you have it. So I do think the more people that are tested with symptoms, the better handle you have on the virus. My worry is that we're going to pick up a lot of kids that aren't symptomatic and aren't spreading it or previously had it with the Department of Education rules. So I am all for making sure we don't send sick kids back. But if, for instance, parents of a kid had COVID 2 weeks ago, 3 weeks ago, and the kid never had symptoms, well, now he's sitting next to Johnny in class who has COVID, and he has to be tested in 4 days. His PCR may be positive because he really did have COVID when his parents did, but he doesn't have it now. But I have a PCR test that's positive that now keeps him out of school for 10 days because that thing could be positive for 3 months. And so we're having a lot of trouble with symptoms versus not symptoms. Now, if you have a fever and all those things, then maybe it is active COVID at that time. But our test doesn't tell us that. And I think that's the frustrating thing for us, is finding the temporal relationship between sickness and just having it. There is almost no literature suggesting asymptomatic kids pass infection. It just doesn't exist. Is it theoretically possible? Of course, anything is theoretically possible, but that it just isn't the way of transmission for kids because they don't generate enough virus without having symptoms. So I think the thing parents should watch for is honestly any respiratory illness. If they haven't had COVID in the last 90 days, I would get checked. And I think we're working on trying to keep our supplies up to continue to be able to test. I know the health department's doing the same. It is a little hard because everybody stopped making the tests when things got better. So now we're all on back order trying to get tests. But our other advantage is we have a different kind of test coming that will test whether you're acutely sick or whether you were sick before. And so I think as we should have those tomorrow. So I do think that will help with that question of, is my kid sick right now, or does my kid just hanging on to a virus? I think that's where we're at right now in terms of trying to parse out different kinds of infections. But to your point about parents, I mean, that's our job, is to see them when they're sick, whether we have 9 on the schedule or 111. So we are doing whatever we can, and we would like to. I've talked about this actually with my kids' school here in High Springs. Having those antigen tests available at school would actually be really good for the symptomatic kids at school to know right then. It's a simple test. It runs like strep. Honestly, it's easy to do. School nurse could do it. I don't want to put a burden on them either, but it is something I think maybe you could we could head off a lot faster with something like that. So if there's a strategy that could be in school that I think would help, that would take some of the load off parents having to come, go get tested, wait 48 hours for results, all that might be on the list. And that's very similar to the test that the parents can get at CVS or whatever. They're not complicated. So that may be a solution to the parents not having to do a test if it's something that's available at the school already. So. Yeah. So depending on the study that you read, people will either tell you masks are super, super amazing or not worth anything. And I think the answer to that's probably in between. A well-fitted N95 mask that we're going to use if we're worried about virus transmission as a doctor or nurse practitioner is going to filter out about 95, that's the whole reason it's called N95% of viral particles at about the size that COVID is. Once you go down from that to surgical masks and cloth masks, the data gets significantly worse for it not being put on correctly. So most estimates are that an incorrectly worn cloth mask, which is about 95% of them, is about 11% effective. So the issue is there's lots of studies, what's called turbulent flow studies, which show how COVID moves around a room or a car or different situations depending on whether windows are open or air conditioning's on, all those kind of things. The end result is that within 20 minutes, COVID's everywhere. So it's not, you having that there may reduce some of the thick particles, your wet laden particles, but it's not stopping the aerosols. And so as those aerosols are making their way around the room, unless you've got jam up ventilation, they're probably staying in the air for an hour, hour and a half. So any other kid that moves his mask or touches his face, then welcome COVID. And that's why I don't know that the utility is there. Also, they did a study that found that teachers have to talk louder through masks, and the louder you talk, the more aerosol you make. So by making them talk through the mask, you're actually making more aerosols, which is technically going right through your mask anyway. So they're effectively changing the dynamics of their voice, and therefore, if they did have it, are spreading it at a greater rate. Do I think that to some degree there are some kids that benefit from a mask because it helps them with anxiety? Yes. I think there are some kids that probably do feel better being masked because I think that they are fearful of not being masked. So the same reason I could say I think it's a harm to a kid to make him wear a mask, I could also say equally there's a harm to not letting a kid wear a mask because of that. So I think if you look at studies before COVID, like 2015, CDC did a study, WHO did a study, they found that surgical masks are not even close to N95 masks. And that just that difference is enough to say that cloth masks are definitely not better than surgical masks. So knowing kids and hearing parents already tell me that kids are like trading masks at school and or finding one that they forgot theirs, so they got their friends or that sort of thing. We had a UF scientist here do a study on what grows in masks. Her statement to me was that I was going to throw up when I got the results back, just with the bacterial counts and the strange bacteria that you find in there. It was tested against a sweaty t-shirt worn all day and had significantly higher levels of bacteria than the t-shirt. So I think there are pros and cons to everything. Like I said, I don't think it's a full no, and I don't think it's a full yes by any means, but there's not a lot of support that it's protective, despite what is out there. So I think there's a common sense approach to that.
I've seen some of our younger ones that I have seen wearing them in the school. they're touching them a lot.
Oh yeah.
You know, and I was told that right there is bacteria.
All day long. Yep. Absolutely. And they're snotting in it. So the snot just stays there. Your snot's always covered in sinus bacteria. So it's just going to multiply in a wet, hot environment. So you're.
We have families on both sides of the aisle. That's why we've left it optional and having discussions like this with you. That way, there's parents that feel like their child needs to be protected, they can wear them. Or others, you know, would rather their children, you know, not wear masks.
Correct. So the and the parents that are worried because other kids aren't wearing them, like I said, they're about 11% protective anyway, so it's not. And also, you know, they take them off at lunch. You know, COVID doesn't take lunch. So I get the point, but the real reason if you're going to wear a mask and you're worried is it actually reduces the amount of viral load you can get. So if you're directly aerosolized by something, having the mask on will reduce the amount of aerosol that gets in there. So it won't stop you from being sick, but it could technically maybe lessen it a little bit if you were properly wearing it. So, you know, properly wear a cloth mask, if you gave it, say, 48, 50%, you may reduce your viral load by a quarter. And that could be significant versus, you know, flu-like symptoms versus cold symptoms. So that's possible. I think that should be studied, to be honest with you. I don't think it is. But it's certainly not a magic shield.
The numbers different, vaccinated versus unvaccinated in our area.
So I got this question a lot. I've actually answered it to a lot of parents today. So there are two reasons to vaccinate. And we are the only office I know of in all of our counties that actually have a vaccine policy, because we actually require kids to have a certain number of vaccines because they are kind of the tried and true 20-year tested things. And so I say this from a pro-vaccine perspective, but we vaccinate to reduce symptoms or severity or to prevent spread. Those are the two reasons you vaccinate, because you're trying to either protect the individual or protect the population. So what we have seen so far from data is that the vaccines, all of them, protect against severity of disease. If you have any degree of antibody to these, no matter what variant, you are going to do better statistically than if you have no antibodies to variant. So the way COVID works is it goes in stages. It comes in as your first stage, and it's basically the spreading stage. So it tries to go in and copy itself. When it starts to copy itself, then you start to have the respiratory phase, which is why everyone starts with the fevers and the coughs and the colds. And then once it gets past that, it goes into basically the hemodynamic phase, which is when you start clotting or not being able to pull air or oxygen out of your lungs into your body. And that's when we see people on ventilators and all that. So the key to the vaccine is stopping that cascade at the point where you start the first process. And so the thing that starts the attachment process is the S protein. And so that's what the vaccines are designed to do, is mimic you making S protein so that you can't get as sick, because not as many troops make it to the door. That's the goal. It neutralizes it before it gets started. So yes, if the vaccine helps reduce, same as the mask in that case, if it helps reduce 90% of the troops, well, only 10% of the troops can cause the trouble. You're not going to get as sick. If 100% of the troops get in, you're going to get sicker. And so then you go down that progression pathway. And so I think the benefit of the vaccine is to decrease the speed at which that happens and the percentage of the cells that it happens to. And so that should lessen your severity, reduce your risk of hospitalization, reduce your risk of death. That's the ultimate goal. So I agree with that. That's why we're doing the vaccine, and that's who's protected. The other theory was that it would reduce population spread by you becoming a dead end carrier. You just keep it and then it's gone. So like theory is everybody gets vaccinated like smallpox and boom, it goes away. That didn't happen. So vaccinated people can catch and pass, per 3 recent studies, just as efficiently and effectively as a non-vaccinated person. So I will be quite honest with you. It worries me a little bit when the DOE sheet says unvaccinated kid or vaccinated kid has a different rule than vaccinated kid, because they're passing it identically. So if either of them are unsymptomatic or symptomatic, it shouldn't matter. Because if the risk is passing it, not having it, then they're equivalent. There is no difference between a vaccinated kid and a non-vaccinated kid. And so, and all the studies are showing the same viral load, the same transmission rate. It's just those troops don't make it. So you mount the response and they just don't get there. That's the whole point of the vaccine. So the vaccine's doing good on that end, just not great on stopping them before they get going.
Well, one thing, when we were talking about doing this today, a question I got was natural, vitamins, anything natural that individuals can take to help.
Yeah, absolutely. I think that goes to the might help, can't hurt philosophy. Responsible for every viral thing that you respond to ever. That's why a lot of preparations are all Zicams of the world and things like that. It's zinc, 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 because that's kind of your bullets for your viral guns is zinc. No zinc, no bullets. And so I think that's very important. I think society as a whole is chronically vitamin D deficient. I don't think that's ever going to hurt. We live in Florida and still have one of the highest vitamin D deficit populations in the United States. It astounds me. But I think that's always okay. And it is typically why people don't get sick in the summer is because your vitamin D level is the highest. When you go into the winter, your vitamin D level drops and you tend to be more sick. That's especially true in places that don't have a climate like ours, but we just stay deficient. And I think that's why we're seeing it summertime this time. And then vitamin C, of course, always awesome. You can't ever take too much of that. You pee out the extra. So there's no danger in vitamin C. And I think hand washing is probably the number one thing, and air, fresh air. Those 2 things, if you could maintain those as much as possible, I think you reduce your risk automatically. But in terms of everyday vitamin things, those are probably the big 3. And even if you get COVID and get sick, that is recommended that you start. But preventatively wise, I have personally been on vitamin D, zinc. I haven't been on vitamin C. I guess I ate enough oranges. But those 2 the entire time. I've been on that since September of last year. I had COVID at Christmas time this past year. Wasn't fun, but did okay. Had my vaccine a few days ago, actually, because my antibodies finally ran out. But the degree at which you can prep your natural system is significant, because once again, that sets up for your troops to be ready to go. If you're not ready to go, then you're going to suffer. And the majority of the conditions that are the cofactors or the comorbidities in death are all things that actually are people who are vitamin D deficient. So your obesity is number 1 on that list. Almost all people who are obese are vitamin D deficient. Diabetes, vitamin D deficient, and obese. Cardiac issues, all of them are vitamin D deficient. So I'm not saying vitamin D is the key to being better, but it certainly isn't helping your immune system if you don't have it. So I don't think it's a magic cure. I just think if you can get your level up, you give yourself a better chance. So that's what I do at home.
Emerick, I was talking to my wife who's in the medical field. And she said, y'all do a lot with percentages and numbers.
Yeah.
I know right now, we can't say this is all from the school. We're looking at about 58 students positive and 173 of our kids in quarantine, which is about 9% of our population. check with some other districts. Seems like, they're around anywhere from 7 to 8, maybe, just a few that I've called. But does that seem to be in range? Are we a little high? Is there a number when we start getting concerned? What do you think with that?
So I couch this statement a little bit. I'll start with saying that kids are 99.9995% resilient to this virus. So getting it is not the worst thing. I'm not saying we should go out there and have chickenpox parties and every kid should get COVID. But I think what you're going to see, like we have with all the other viruses, like Victoria strain right before COVID came for flu, you're going to get this huge peak of kids who get it. Then they're going to be immune and life goes on until the next virus comes. And so I think the problem is that what that bubble looks like outside of school. So obviously the more kids who get it, yes, can more parents get it and more, the bubble outside that. But there's a critical mass number which you're going to get to where the virus can't go any farther. So if I've infected 40% of the student population, eventually that spread from 1 to 8 kids is going to go from 1 to 3 because the other 5 have already had it. And so at some point you're going to get to that peak and it's going to start to fade off. And I think that's why I would caution against closing school, because you kind of want the peak, because then in 3 weeks you're not dealing with this again when the 1 in 8 kids can go back and get it again. You are at least protected for 3 months. Most of the Cleveland Clinic studies say 8 to 18 months. This is, yes, you can get variant, whatever comes up next. I mean, Omega or whatever it is, but no matter what, you're going to have to get through this version first, and you're going to be better prepared to deal with the next version if you have antibodies. So I think there's not a number that I would be worried about. Because we have seen very little. Now, I'm not saying hospitalization does not exist. I'm not saying there won't be kids that have poor outcomes to this, because that is not a true statement. However, if you go back and look at data as of August 4th, 350 kids under the age of 17 died of COVID since it started. That's 7 kids per state over 20 months. That does not account for comorbid conditions, cancer, car accidents, none of that. And so if you look at that number, more kids die falling than of COVID. So I think the perspective has to be different, because this doesn't really hurt kids. Now, I said we have sent kids personally to the hospital with COVID symptoms. That does happen. And our immune kids, they are definitely at higher risk. There's no doubt. But they were at higher risk for everything. And I don't think that changes how you manage this for the kids. I think it changes how you manage it for the teachers and the adults. I think they have to understand how to be protected from it. And I think they need to take the steps to make sure that they're healthy enough to handle it. With all this being said and all this scariness, it's still a 99.5% survivability rate for healthy people. So if you're under 60 years old, it's 99.5, probably going up, not down. And I know that you were just seeing more cases, so you got to think that's also more cases of people getting better, not dying. The harder thing is we're just seeing people very close to home die. I have it at my kids' school and other places, and I know you guys have had that. That makes it hit home a lot more, but statistically doesn't change anything. And I think that's the hardest thing to do, is look at the numbers and not the feelings, and know that the best place for those kids is in that school. And the best place for them to be successful is in that school. And kids are going to get sick. Kids are going to pass germs. And if you're going to give me odds of 99.995 on anything, I'll take it. And so we're prepared to handle the kids who get abnormally sick, and we're watching out certainly for our high risk kids. But there aren't, there is no data. I want to say a lot of it. There is no data to state that this is a kid problem. England, they already did Delta before us. They had 500,000 COVID cases in kids, 25 deaths. 25. I think more kids get hurt by TikTok than that. So I'm a little, the 17 and under population certainly is very, 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 very low risk. Not no risk, nothing's no risk. But I think if you can keep a 9% honestly positivity rate, you're probably looking at a week or two, and then all of a sudden that's going to drop because there's nowhere else for it to go. I think the hard part is when we keep sending these kids home to come back and get re-quarantined, you're just once again shuffling the deck until everybody gets their 9%. But there's not a better way to do it. I get you can't leave COVID positive kids at school, symptomatic or not. But
you brought up some very good points there. My kids are in the school. Miss Anderson's kids are in the school. I mean, I could go through all administrators. We have an administrator who has a 16-month-old child that's in our pre-K program.
Yep.
And so I know you said that your kids are in school. So,
yes.
I know you're wanting to get with your kids now and eat supper, but we just really appreciate you taking the time to talk with us, the time that you spent with us. I know our parents are going to get a lot from this video. Dr. Emerick.
I appreciate it.
Your opinion holds a lot of weight in our community. We're very fortunate for what you do for all of us. So is there any, as we close out, is there anything you would like to close out with, or anything that we didn't ask?
No, I think what I wish would happen is that there would be a little more data given to people and a little less fear. Because it's, I think, not only making it harder to manage this, it's affecting the kids in ways we haven't seen yet. So from my perspective, our anxiety and depression kids have multiplied tremendously. And I think if, as parents, everybody could look at the numbers and realize how okay kids are despite all these things, that maybe they could tell the kids they're okay too, and maybe not be so anxious, because I think a lot of them feel like if they step outside and sneeze, someone's going to die. And we have kids that won't take their mask off for me to look in their throat because they're afraid they might get infected. And so I think when we get to this point, we have to step back and say, what are we doing to these children that are at no risk, instead of how can we help these children mitigate the risk, which is what we have to do their whole lives. And so I just would like parents to just help their kids through this instead of listening to the fear and keeping the fear going. COVID's not awesome. COVID's awful. I hate COVID. COVID's a real thing. It is a pandemic. I get all that. It is just not a kid one. And I think if we could make the kids realize that they're not the problem and that they can do things normal life-wise, I think that's what's ultimately going to make them better. So
I know your office here, but thank you. Got your phone number, and you have my cell phone number. If you see anything, numbers get anything that you hear or whatever, please call me.
Absolutely.
Best for our kids.
Absolutely. Absolutely.
With that, Dr. Emerick, we appreciate you taking the time to be here with us.
Thank you.
Go enjoy your family.
Yes, sir. Thank you for doing what you do. I appreciate y'all.